So all-in-4 procedure is essentially, we have patients that have either no teeth or they have failing teeth, and they want a procedure where they can come in within about 3 hours and have a number of implants placed to allow us to then restore a bridge on those teeth. It's quite an advanced procedure where we do a lot of the information taken before any of the surgery actually happens. So that means that when we get to the actual day of surgery, we have all of our guides in place, we have all of our systems in place so that it's actually a really smooth process. So the all-in-4 procedure kind of started out with a clever fella over in Spain called Malo, and his procedure kind of started about 20 years ago. And it was a relatively rudimental procedure where we placed a number of implants and at some point in time we put a bridge on top of it. Now, things have evolved over the years and we're using more advanced technologies, more advanced procedures to allow us to be smoother in our transition from the implant placement to the bridge to the final restoration. And at Ewan Bramley's, we've got all that technology wrapped up in one place, which allows us to provide a very seamless transition from failing dentitions to no teeth to implants and then final restoration. So the all-in-4 procedure is ideal for patients that have no teeth, patients that have loose dentures and they can't tolerate their loose dentures. Really great for patients that have gum disease and they have loose teeth and pain associated with their loose teeth. Or just patients that are kind of have been afraid of the dentist, they want to gain some confidence in their smile again, and this is one way to allow us to do that. Yeah, so your first appointment will be with Ewan, and what he'll do is he'll start establishing kind of your needs and wants. He'll also gather a whole bunch of information, so we'll take a CT scan to assess your bone volume. We'll also kind of start planning where we want the future teeth to be, because that's probably one of the most important things. We want to know where the future tooth is, so then I know where we can place the implants to help restore those teeth. Once we have all that information, it all gets sent to the lab, and the labs are going to make some really precise surgical guides. And these surgical guides allow us to place the implants in a very precise manner, and a very safe manner, so that the implants are relative to you in the correct way. Once all the laboratory stages are done, then you'll be booked in for the day of surgery. You'll come in, we'll provide all the local anesthetic that you need to make the procedure very comfortable. The implants will be placed, and then the temporary prosthesis will be put on right away. You'll then go away. At that stage, you'll expect a little bit of swelling, a little bit of bruising, which is normal, usually for 4 or 5 days. I tend to only ever give paracetamol and ibuprofen for my patients. That's usually plenty to kind of alleviate the pain. And then after that stage, you'll then go through what we consider the restorative phase, which is once the implants have integrated with you, we start the process of fabricating the final restoration. So generally from day of consultation to final restoration is usually about 4 months, 4 to 5 months. The day of surgery, which is the big day, usually takes about 3 hours, and that's to do the top jaw and the bottom jaw at the same time. Yeah, so probably the biggest benefit of the all-in-4 procedure is that you have immediate results. You know, you walk in the morning, and at the end of the day, 3 or 4 hours later, you're walking out with a new set of teeth. There's one surgical procedure as well, so there's not a drawn out kind of long stage procedures. You know, we do it once, we place the implants where they're supposed to be, and then that's it. It's also relatively cost effective because we're placing a number of implants to replace a lot of teeth, which means that you kind of get better bang for buck, if you will. Yeah, I guess every patient's a little bit different. Some people are super excited about it because they've been either with a really loose denture or loose teeth or broken teeth, and they're really just happy to turn a new page and start over. And some patients are extremely nervous because they don't know what to expect. But what I find at the end of the procedure is most of the patients say, oh, is that it? You know, I wasn't expecting it to be so easy, or I wasn't expecting it to be so fast. So that we get that a lot. So yeah, every patient varies a little bit. So my area of specialty or expertise is in guided surgery. And I use guided surgery to help me pre-plan the surgery before we come to the day of it. And the advantage of that is that I have once already done the surgery in my head. I've done all the planning weeks or months before. So when it comes to the day of surgery, it's just a process, and it's already almost been done already, which I think allows my patients to have the benefit of speedy surgery, minimally invasive, and again, in my opinion, some of the best surgery in the UK right now. Once the implants are done and the final restoration is placed, one of the most important things with our all-on-4 procedures is the maintenance side. And it's not implants fit and forget. You must start a process of maintaining the implants. And that's really important to get the longevity out of it. And I've placed about 4,000 implants in about 10 years. And I've had to take out about 100 of my implants in that time. Which the success rates for that 10 years is very, very good. And part of that is my patients are really on board with maintaining them. And if they can maintain them well, you can expect a long-term prognosis for your implants.